Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. There are three major issues we wanted to address today. All of them are regulatory, but I feel the need to brief NAAOP members on the legislative process as well. The next 3 weeks will witness Congress returning to Washington in a variety of ways, either in person or virtually, and they will be working on a whole host of items of legislation, including a COVID 4.0 package to address the ongoing pandemic. It's expected that they'll try to reach some kind of conclusion by early August and try to. This is probably going to be another $1 trillion+ bill to address the pandemic's economic consequences and the virus spread itself. It's not clear whether they'll be able to reach conclusion, but they will be working hard over the next 3 weeks, both the House and Senate, to achieve that goal. The O&P Patient-Centered Care Act is in the mix. The NAAOP is working with its alliance partners, including and in particular AOPA, that's taking the lead on that legislation, to move that forward through Congress and do all we can to try to append it to the COVID bill. It's not likely, I must tell you, it's going to be a very tough lift. Both houses of Congress have already signaled that they will be very narrow in their focus on this legislation to make sure it has almost nothing to do other than COVID-19. So let me move on to the developments in the regulatory front. The first is prior authorization. As you know, CMS proposed prior authorization late last year. They intended to go forward with a program on May 11th, a pilot program in 4 states, Texas, California, Michigan, and Pennsylvania, for 6 lower limb prosthetic codes, primarily prosthetic foot codes in large measure. The bottom line is that they postponed that in April as a result of the COVID pandemic. And the NAAOP was very supportive of that. We also worked on that issue to make sure that that was hopefully delayed, and in fact, that in fact is what they did. However, CMS just announced recently, within the last 2 weeks, that they do plan on moving forward with prior authorization of these codes on September 1st. Claims with dates of service after September 1st. The pilot will occur September 1st. The rollout of the national program will occur December 1 of 2020. That's about a 3-month shorter pilot period. And NAAOP feels as though that's just not enough time to learn from the rollout in order to affect and make the national program more efficient and effective. So we're concerned. The circumstances that existed in April with respect to the pandemic have not changed. In fact, you could argue that they've gotten worse and more diffuse, more widespread across the country. We just don't feel that it's time to implement a new documentation program in prosthetics and fear that patients will ultimately lose access to fairly sophisticated lower limb technology. That's a problem. We'll continue to work on that issue and see if there's any way that CMS can continue to delay prior authorization until at least the 1st of January. Next is the auditing. CMS did announce that they would resume auditing of all providers by all contractors. So that includes RAC audits and certs and MACs and ZPICs and everything else. They plan on reinstituting auditing on August 3rd, which is just around the corner. And we feel as though it's premature to do that. Healthcare providers across the country are battling the pandemic and on the front lines, and we don't feel as though they ought to be concerned with defending claims that may have been submitted as long as 3 years ago. It's unfortunate. We all knew that auditing would return. My assumption is that CMS is getting heavy pressure from the RACs who actually make their money through a contingency fee payment and are not getting paid if they're not auditing. So we'll continue to monitor that issue closely, but it's an issue that impacts much more than O&P. It impacts all healthcare providers. And finally, with respect to the Veterans Administration, there's been some really great developments. You may recall that in September of 2018, the Office of Inspector General of the Veterans Administration issued a report on not otherwise classified billing codes, or NOC codes, typically referred to as miscellaneous. Basically, the report said that the VA process was not sound, neither for assigning codes to existing prosthetic components and new technologies, nor in setting reimbursement levels. The VA did a comprehensive study of this, and they ultimately appear to have issued a directive in June 24th, that Directive 1045, that ultimately addresses the situation. They keep and reiterate the fact that CMS will continue to use HCPCS codes where CMS has acted and has determined particular coding for a particular product or device. And they also affirmed that they would allow the VA to use its own codes, create separate codes for new technologies if CMS did not otherwise code a particular new technology or product. And so that's a huge victory. That was something that the NAAOP, along with its alliance partners, wrote to VA and said that it's important that we have a separate coding process other than the process run by CMS, because frankly, there's a real problem with that process, and it really is impacting the ability of patients to get access to new technologies. We're happy to say that the VA did make that decision. They have independent authority to code new technologies. And although the current process for getting a new code is somewhat murky at the current time, we are going to be working with the VA to clarify that process, and will inform the NAAOP membership accordingly. Thank you so very much, and have a great summer.